Extra tachycardia view. All supraventricular tachycardia, SVT, is like a rapid or irregular heartbeat that affects the upper chambers of the heart. A rare heartbeat is called an arrhythmia. SVT is also called paroxysmal supraventricular tachycardia. Normal heart rate is 60 to 100 beats per minute. A heartbeat of more than 100 beats per minute is called tachycardia, tachycardia. During an episode of SVT, your heart beats about 150 to 220 times a minute, but sometimes it can beat faster or slower. Most people with tachycardia for more than a week live a healthy lifestyle without restrictions or treatment. For others, lifestyle changes, medications and cardiac procedures may be needed to control or eliminate rapid heartbeat and related symptoms. Symptoms. The main symptom of overactive tachycardia, SVT, is a rapid heartbeat, 100 beats per minute or more, that can last from a few minutes to a few days. Rapid heartbeat can come on suddenly with a sudden, normal heart rate. Some people with SVT have no symptoms or signs at all. Signs and symptoms of upper tachycardia may include fast heartbeat, hitting your chest, hitting hard, sensation that hits hard on the neck, weakness or feeling very tired, fatigue, chest pain, shortness of breath, light hair or dizziness, sweating, fainting, syncope, or near fainting in infants and very young children. Signs and symptoms can be difficult to detect. It includes sweating, malnutrition, pale skin and severe body rash. If your baby or toddler has these symptoms, ask your child's doctor for a SVT test. When to see a doctor. Supraventricular tachycardia usually does not endanger life unless you have a heart attack or other heart problems. However, in severe cases, an episode of SVT can cause fainting or cardiac arrest. Call your doctor if you have a very rapid heart attack for the first time, and if the abnormal heartbeat lasts longer than a few seconds. Other signs and symptoms are not related to a serious health condition. Call 911 or your local emergency number if you have a SVT episode that lasts longer than a few minutes, or if you have an episode with any of the following symptoms. Chest pain, shortness of breath, weaknesses, dizziness. Causes SVT occurs when electrical signals linked to your heartbeat are abnormal. For some people, episode of abnormal tachycardia is associated with an obvious onset, such as exercise, depression, or poor sleep. Some people may not have the obvious interest. Things that can cause an episode of SVT include heart disease, heart failure, other heart problems, such as Wolff-Parkinson-White syndrome, chronic obstructive pulmonary disease. It consumes too much caffeine, heavy drinking, drug use, especially stimulants such as cocaine and methamphetamines, pregnancy, smoking, thyroid disease, certain medications, including asthma medications and cold drugs and allergies. What is a normal heartbeat? SVT begins above the ventricles of the heart, supraventricular, in the upper two chambers or a group of cells called the atrioventricular, AV, node. Understanding how this happens can help you to understand how the heart beats. Your heart is made up of 4 chambers, 2 upper chambers, atria, and 2 lower chambers, ventricles. Your heartbeat is usually controlled by a natural pacemaker, sinus node, in the upper right room, atrium. The sinus node sends electrical signals that normally initiate each heartbeat. These electrical signals travel across the atria, causing the heart muscle to compress and pump blood to the ventricles. Next, the signals reach the AV node. AV node minimizes electrical signals. This slight delay allows the lower heart chambers to fill with blood. When electrical signals eventually reach the ventricles, the lower chambers of the heart contraction, which draws blood to the lungs or throughout the body. In a healthy heart, this process of signing the heart usually goes smoothly, resulting in a typical heartbeat of 60 to 100 beats per minute. SVT occurs when a faulty electrical connection to the heart removes a series of primary atrium bits. When this happens, the heart rate increases very rapidly, and the heart does not have enough time to replenish blood before entering the chambers. As a result, you may feel dizzy because your brain does not get enough blood and oxygen. Supraventricular tachycardia falls into 3 major categories. Atrioventricular nodal reentrant tachycardia, AVNRT. This is the most common form of tachycardia in men and women of any age, although it is more common in young women. Atrioventricular regenerative tachycardia, AVRT. AVRT is the second most common type of upper extremity tachycardia. It is usually found in young people. Atrial tachycardia. This type of SVT is more commonly found in people with heart disease. Atrial tachycardia does not include the AB node. Other types of upper tachycardia include sinus tachycardia, sinus nodal reentrant tachycardia, SNRT, improper sinus tachycardia, EAST, multifocal atrial, MAT, tachycardia I, junctional ectopic tachycardia, JET, non-paroxysmal junctional tachycardia, NPJT. Risk factors. Supraventricular tachycardia is the most common type of arrhythmia in children and adolescents. It often happens to women, especially pregnant women, or it can happen to anyone. Other factors that may increase the risk of overexpression of tachycardia are age. Some types of SVT are more common in people who are middle-aged or older. Vascular disease, other heart problems and previous heart surgery. Overcrowding of the heart disease, abnormal heart valves, premature heart surgery, heart failure, cardiomyopathy and other heart injuries increase your risk of getting SVT. Congenital heart disease. Being born with a heart condition or heart disease can affect your heart rate. Thyroid problems. Excessive or inactive thyroid gland may increase the risk of overactive tachycardia. Drugs and supplements. Excessive coughing of customers with cold and certain medications can cause an episode of excess tachycardia. Anxiety or emotional distress, physical fatigue, diabetes. The risk of heart disease and high blood pressure is greatly increased with uncontrolled diabetes. Obstructive sleep apnea. This condition, in which your breathing is disturbed during sleep, may increase the risk of further tachycardia. Nicotine and drug abuse. Nicotine and illicit drugs, such as amphetamines and cocaine, can cause episode of further tachycardia. Problems over time. Untreated and common episodes of supraventricular tachycardia can weaken and lead to heart failure, particularly if there are other coexisting medical conditions. In extreme cases, an episode of supraventricular tachycardia may cause unconsciousness or cardiac arrest. Prevention. To prevent an episode of supraventricular tachycardia, it's important to know what triggers the episodes to occur and try to avoid them. Healthy lifestyle changes can help protect your heart. You might want to try eating a heart-healthy diet, increasing your physical activity, avoiding smoking, keeping a healthy weight, limiting or avoiding alcohol, reducing stress, getting plenty of rest, using over-the-counter medications with caution, as some cold and cough medications contain stimulants that may trigger a rapid heartbeat, avoiding illegal drug use, such as cocaine, ecstasy or methamphetamines. For most people with supraventricular tachycardia, moderate amounts of caffeine do not trigger an episode of SVT. Large amounts of caffeine should be avoided, however. Consider keeping a diary to help identify your triggers. Track your heart rate, symptoms and activity at the time of an SV diagnosis. To diagnose further tachycardia, your doctor will ask you questions about your symptoms and your medical history and perform a physical examination. Blood tests are usually done to check other health conditions that may cause your symptoms, such as thyroid disease. Your doctor may also schedule several tests to check your heart health. SVT detection tests include electrocardiogram, ECG. During an ECG, nerves, electrodes, that can detect the electrical activity of your heart are attached to your chest and sometimes to your legs. An ECG measures the time and duration of each phase of electrical activity in your heart. Holter monitoring. This portable ECG device can be worn for a day or more to record your heart activity as you perform your procedure. Event monitoring or mobile telemetry device. For occasional episodes of SVT, you may be asked to wear an ECG device for a long time, up to 30 days or until you have an episode of SVT or arrhythmia or common symptoms. Echocardiogram. In this non-invasive test, a handheld device, transducer, mounted on your chest uses sound waves to produce a picture of your heart size, shape, and movements. Loop recorder can be installed. This device receives an unusual heart rate and is inserted under the skin in the chest area. If your doctor does not have a heart attack during those tests, you may need other tests, such as pressure test. For some people, excessive tachycardia is caused or exacerbated by stress or exercise. During a stress test, you will be asked to use a treadmill or a standing bike while your heart activity is being monitored. If you are unable to exercise and your doctor thinks that a heart attack can cause your arrhythmia, you can get a medicine to regenerate your heart in the same way as exercise. Tilt of the table test. Your doctor may recommend this test if you have been weak. Your heart rate and blood pressure are monitored as you lie down on the table. The table is tilted as if standing. Your doctor can see how your heart and the nervous system are reacting to angle changes. Electrophysiological examination and mapping. In this test, doctors insert small catheters into your bloodstream in several places within your heart. When in place, electrodes can map out the spread of electrical signals through your heart. In addition, your cardiologist may use electrodes to encourage your heart to beat at rates that may cause, or even stop, arrhythmia. This test allows your doctor to see the location of the arrhythmia and what could cause it. Treatment. Most people with high tachycardia do not need treatment. However, if you have long or frequent episodes, your doctor may recommend the following. Carotid sinus massage. The doctor puts a gentle pressure on the neck where the carotid artery divides into two branches. During this exercise, the body releases chemicals that reduce heart rate. Do not try to do this alone. Vagal travel. You can stop the SVT episode by using certain movements like your breathing and stress as you would during bowel movements, paying attention to your face in ice water, or coughing. This movement affects the nervous system that controls your heartbeat, blood vessels, which often causes your heart rate to drop. Breathing of the heart. If you are unable to stop the SVT episode alone using vaginal methods, your doctor may use cardioversion. Cardioversion can be done with medication or during cardiac procedures. In this process, panic is brought to your heart by paddles or patches on your chest. It currently affects the electrical signals in your heart and can restore normal rhythm. Medications. If you have common episodes of SVT, your doctor may prescribe medication to control your heartbeat or restore normal heartbeat. It is very important to take the medication as prescribed by your doctor to reduce complications. Pipe discharge. In this procedure, the doctor inserts small, flexible tubes called catheters into the arteries or veins, usually in a cavity. The nerves in the catheter's back use heat or cold energy to create tiny scars on your heart to block abnormal electrical signals and restore normal heartbeat. Pacemaker. It is not uncommon to use a small implanted device called a pacemaker to encourage your heart to beat at a normal rate. The pacemaker is placed under the skin near the collar with a minimally invasive surgical procedure. The phone connects this device to your heart. Lifestyle and home remedies. Your doctor may suggest ways to adjust your lifestyle to keep your heart as healthy as possible. Changes in healthy living include: eat healthy heart foods. Eat healthy foods rich in fruits, vegetables and whole grains. Reduce salt and saturated fat. Exercise regularly. Exercise daily and increase your physical activity. Stop smoking. If you smoke and cannot quit on your own, talk to your doctor about strategies or plans to help you break the habit. Maintain a healthy weight. Obesity increases the risk of heart disease. Keep blood pressure and cholesterol levels under control. Make changes in your lifestyle and take medication as prescribed for high blood pressure, hypertension, or high cholesterol. Limit alcohol consumption. If you choose to drink alcoholic beverages, do so in moderation. For older adults, that means 1 drink per day for women of all ages and men over the age of 65, and up to 2 drinks a day for men 65 and under. Keep track of. Take your medication as prescribed and have regular follow-up appointments with your doctor. Tell your doctor if your symptoms worsen. A different tree. Some types of complementary therapies can help reduce stress, which can cause SVT in some people. Strategies for reducing stress include: yoga, meditation, relaxation techniques. Preparing for your appointment. If you think you may have high tachycardia, make an appointment with your family doctor. If diagnosed early, your treatment can be simple and effective. You can be referred to a cardiologist. Appointments may be shorter. Because there is usually so much to discuss, it is a good idea to be ready for your appointment. Here is information that will help you prepare for your appointment, and what you can expect from your doctor. What you can do. Know any pre-appointment restrictions. When making an appointment, be sure to ask if there is anything you need to do in advance, such as cutting back on food. You may need to do this if your doctor prescribes any blood tests. Write down any symptoms you have, including any that may not be related to cardiac arrhythmia. Write down key details, including family history of heart disease, stroke, high blood pressure, or diabetes, and any major stresses or recent life changes. Make a list of all medications, vitamins or supplements that you're taking. Include those bought without a prescription. Take a family member or friend along, if possible. Sometimes it can be difficult to remember all the information provided to you during an appointment. Someone who accompanies you may remember something that you missed or forgot. Write down questions to ask your doctor. For supraventricular tachycardia, some basic questions to ask your doctor include: what's the most likely cause of my symptoms? Are there other possible causes for my symptoms? What kinds of tests will I need? Do I need to do anything to prepare for these tests? What's the most appropriate treatment? Are there any foods or drinks that you recommend I avoid? Is there anything you suggest that I add to my diet? What's an appropriate level of physical activity? How often should I be screened for heart disease or other complications of supraventricular tachycardia? I have other health conditions. How can I best manage these conditions together? Is there a generic alternative to the medicine you're prescribing? Are there any brochures or other printed material that I can take home with me? What websites do you recommend visiting? What to expect from your doctor? Your doctor is likely to ask you many questions. Being ready to answer them may save time to go over anything you want to spend more time on. Your doctor may ask: when did you first begin having symptoms? Do you always have symptoms, or do they come and go? How severe are your symptoms? Does anything seem to improve your symptoms? What, if anything, appears to worsen your symptoms? Do you have a family history of abnormal heart rhythms?